Okay, so a lot of you have asked about the MPV on a CBC, complete blood count, and here's what it means. Hi, I'm Dr. Joyce Kneif. I see a lot of complex conditions in my practice, and I like to look at labs really closely. So an MPV stands for mean platelet volume. And this is one of these labs that you really have to read in context with other labs because by itself, it doesn't mean a whole lot, and it can have a lot of conflicting interpretations, which is why a lot of doctors kind of just like ignore that it exists. So in a very general sense, a high MPV will mean that you have a platelet volume that's really big, and a low MPV would mean that you have a platelet volume that is really small. And when you have a bigger platelet volume, this means that your bone marrow is pushing out more younger platelets that kind of work a little bit better. Whereas if the platelet volume is a little bit smaller, then that's generally like older platelets that work a little bit less well. So if you have big fluffy platelets that your bone marrow is pushing out a lot of the times we can interpret this as your body reacting in a way where it feels like it needs to clot at a moment's notice. And sometimes this can be like weird things going on, like there is a condition called idiopathic thrombocytopenia, which is kind of your body not having enough platelets and therefore it wants to push out more and therefore they're kind of bigger. But this can also happen in chronic inflammatory conditions too. If you find that your MPV has been like chronically just a little bit bigger, it could be that your immune system is reacting in a way where it feels like you're in danger. So these are things like usually high pain conditions like rheumatoid arthritis or any other like arthritic or fibromyalgia, like high pain conditions tend to have a higher MPV. And the reason why I say that it's not really as useful without the context of other labs is that with some of these high pain conditions, if they are chronic inflammatory and you've had chronic inflammation, sometimes that chronic inflammation can suppress your bone marrow production of certain things like platelets too. So having really small having small platelets, so a low MPV, could also indicate that you have something really chronic inflammatory that's been going on long term. And that can also happen in autoimmune disease. So you may have an autoimmune disease that can present with a high MPV or a low MPV, and it kind of, you have to take a look at the MPV in context with other things. So do you have high inflammation? Do you have high pain? Was your immune system suppressed in any way with like immune suppressive medications? Were you ever on chemotherapy? Because a lot of the times, if you suppress the bone marrow, over time, if you suppress the bone marrow, the MPV will be a little bit smaller. But if you take that lever off, so say you just completed chemotherapy and now you're off of it, or you just switched your autoimmune medications from like a DMARD to a biologic, or you went on a DMARD and a biologic, these can push the MPV in different directions. Because if your bone marrow went from a place of suppression to now you're not suppressing it, then it's going to kick out a lot bigger, fluffier platelets, and then your MPV is suddenly going to rise. So yeah, long answer short, MPV by itself doesn't give you a ton of information, but it can give you sort of a sense of what the bone marrow has been doing and sort of the body's perception of threat in your moment. So if the bone marrow has been working really hard, then it's going to be a high MPV. If it's been a little bit more suppressed, then it's going to be a low MPV. Versus if your body's response to like the environment where it feels like it is in threat of danger, and this goes into like some trauma work too. Like if you're constantly feeling like you're going to be mauled by a tiger, then it makes sense for you to make a bunch of fluffy reactive platelets, because if you get hurt, then you can clot really quickly and then you won't bleed out. Versus if you've been in a chronic state and you are just completely in like a freeze state of like wiped out, including your bone marrow, then you're probably not going to have like as great reactive platelets. Your platelets are going to be small and old. So yeah, hopefully this helps.